called Jash Agraval. My name is Jash Agraval. I'm a clinical radiologist, and I'm currently the chair of the New Zealand branch of RANZCR. And I also sit on the MATEC committee, which is the Māori Aboriginal Torres Strait Islander Empowerment Committee. And just finished a stint as the Deputy Chief Censor for the last 6 years. So I've been involved in the college since about 2018, and previous to that on the Trainees Committee. My journey into Radiology Across Borders started after I became a new fellow of RANZCR. I'm originally from Fiji and came to New Zealand when I was about 2 years old and was keen to kind of explore doing work, I guess, for my birth nation, and then came across Radiology Across Borders and met Suresh. And I've been involved since around that time. And I guess my key area of involvement currently is the co-clinical lead for the International Certificate of Radiology Fundamentals, which has been going for, I think we're on our 5th year now, and I'm the lead, or co-lead rather, of the abdominal curriculum associated with that as well. That's sort of the main area of work I do, although every year or every 2 years I also go on site visits. So have been to Fiji, to Mongolia, and I have a couple of site visits coming up as well. I think one of the great things about a site visit perspective is going to developing economies or nations that you've previously would never have thought of going to. So Mongolia is a great example of one, and I think not only from the tourism perspective, but actually viewing a city from the eyes of its inhabitants and actually the medical workforce, and getting a sense of actually how medicine or radiology and medicine in general works in those countries is really amazing, and you meet some very dedicated people. A secondary highlight for me was actually going back to Fiji and teaching in places and spaces that my family had a long history with, and also in the hospital, for example, that I was born in. Teaching the radiology registrars there was great, and also trying to give back, I guess, to a country that I hail from. I guess one of the other highlights probably would be, or one of the benefits from my involvement with RAB would also be just meeting some amazing doctors and radiologists in the journey, not in the host nations or the places that we visit, although that's also amazing, but also other radiologists from across Australia, New Zealand, and the world. Some of the connections that we've had from very like-minded people have been great, and actually formed some great friendships outside of RAB, and also connections involving RAB, but also outside of RAB for collaborative research and other experiences. So it's been really great in terms of networking and building friendships. I think just extending on that point is really just building close relationships with other radiologists across Australia and New Zealand. Again, being involved in this work, you're dealing with people who've got a similar ethos to you with regards to work, but also with regards to education. And there's a few examples of now we do some collaborative research together across Australia and New Zealand because we've had some connections through RAB. It's also been great because I sit on the executive of RGANS, which is the abdominal imaging group essentially of Australia and New Zealand. They've got a partnership with RAB. So initially I was on the RAB side doing some projects with them. Now I sit on their executive, and actually been able to share the experiences with Radiology Across Borders and how rewarding that has been. And now we have these collaborative trips going together, and potentially some workshops and conferences that will be held in Pacific nations within the next 12 months. We will be inviting radiologists from those nations to actually come to the RGANS meeting. So that's also been quite an added benefit, I think. But there's lots of ways. I mean, there's if you kind of Google RAB, get involved. There's a whole page there, and Radiology Across Borders is huge now. There's so many projects. So there's certainly the site visits, and the more radiologists that are keen to do site visits, the more sites that we can actually go to across the Pacific, Asia, and even now Africa with the first site visit in Tanzania. But there's lots of other projects involved. So, for example, the International Certificate of Radiology Fundamentals, which I co-lead as mentioned, we always need people to give clinical tutorials with those, or more tutorials in their areas of expertise, but also mentoring programs, people doing ICRF, but also other mentoring from a radiographer space or radiologist space in those nations. Tides, which started as a disaster relief project, now is actually giving second reads to Samoa, to the Cook Islands, and there's often a roster of radiologists that might be available for that. You might do 3 to 10 cases a week, for example, and then again, that's mutually beneficial for the radiologists that are in country, or the radiographers that are in country, but also for us as radiologists in Australia, New Zealand, and elsewhere, because you see some amazing cases, and actually quite rare cases, particularly in the space of infectious disease, for example. So it's actually a dual learning experience. So, and there's multiple other products, virtual conferences that you can get involved in as well. There's breast-specific workshops, pediatric workshops, cardiac workshops, or even if you have an area of expertise that you may have an idea in, you can also potentially start something up. So it's fairly limitless with regards to RAB, and if you don't necessarily aren't in the space to do a site visit, it's not so much about site visits anymore, but also about sustainable work going forward. My advice would be, don't consider it, just do it, because it's enriching both for you professionally, personally, culturally, but also you're giving your skill, which is very much appreciated, to people in developed and developing economies. So I think it's a win-win, and I think we in Australia and New Zealand at least live in a very privileged space, and we get amazing radiology education through RANZCR, one of the best training programs in the world in terms of the breadth and the generalist education that we get, and being able to share that I think is great. So we're in a privileged position, so being able to give back and share those expertise is a privilege in itself. But yeah, it's just, don't think about it, just do it.